Good afternoon and welcome to Thoughtful Thursday, where we continue to celebrate the positive developments transforming primary care across the United Kingdom. Today's episode focuses on one of the biggest changes currently shaping the future of the NHS, the growing move towards neighbourhood healthcare and integrated community services. Over the past year, there has been a renewed national focus on delivering more care closer to home. Rather than relying on hospitals as the first point of care, GP practices, primary care networks, community services, and local organizations are working more closely together to provide joined-up support for patients. This shift places prevention, early intervention, and personalised care at the center of everything primary care does. The impact of this approach is already proving incredibly encouraging. Patients are beginning to experience a more connected healthcare journey, with professionals working collaboratively across different services rather than in isolation. Whether someone requires support for a long-term condition, mental well-being, rehabilitation, or social care, practices are increasingly able to coordinate the right support at the right time. One of the most positive aspects of neighbourhood healthcare is that it looks beyond illness alone. Healthcare teams are recognizing that good health is influenced by many different factors, including housing, employment, physical activity, mental well-being, and social connection. By working alongside local authorities, charities, voluntary organizations, and community groups, practices are helping patients access a much wider network of support than ever before. For patients, this means healthcare feels more personal and more accessible. Instead of navigating multiple organizations independently, they benefit from services that communicate with one another and work towards shared goals. Many patients report feeling more supported because their care is better coordinated and tailored to their individual circumstances. Practice teams are also experiencing significant benefits. Greater collaboration between GPS, pharmacists, nurses, social prescribers, care coordinators, physiotherapists, and community clinicians allows every member of the multidisciplinary team to contribute their expertise. This not only improves patient care, but also creates a more sustainable way of working by ensuring that patients are seen by the professional best placed to meet their needs. Importantly, this model allows practices to place an even greater emphasis on prevention. Rather than waiting until illness develops or worsens, teams are investing more time in health promotion, early diagnosis, regular reviews, and personalized support. This proactive approach is helping patients remain healthier for longer while reducing unnecessary hospital admissions and improving overall quality of life. Prevention and improved access are central priorities in the current direction of GP services. Another encouraging outcome has been the stronger partnerships developing within local communities. Community organizations are playing an increasingly valuable role alongside primary care, helping patients access exercise programs, well-being activities, financial advice, carer support, and volunteering opportunities. Together, these services create a much broader support network that extends far beyond traditional healthcare. This development demonstrates that the future of primary care is not simply about treating illness. It is about building healthier, more resilient communities. By bringing together healthcare professionals, community services, and local organizations, practices are creating a system that is more joined up, more compassionate, and better equipped to meet the needs of patients both now and in the future. At General Practice Solutions, we are proud to support practices as they continue to evolve. Through operational excellence, workforce support, and streamlined administrative services, we help create the capacity that enables practices to embrace innovation, strengthen collaboration, and deliver outstanding patient-centered care. Thank you for joining us for this week's Thoughtful Thursday. We look forward to sharing another positive story from primary care with you next week.